I'm Magnus Eklund, founder of Synergetic Myofascial Therapy. In this upcoming video, you're going to see a type of body work that you might have never seen before. This is very different than the traditional massage such as Swedish and deep tissue. We work on improving posture, mobility, and structural balance. Check us out on our website, mindandbodyinc.com. So many people come to us with frozen shoulders, rotator cuff problems, and other shoulder conditions. Here I'm working with the fascia surrounding latissimus dorsi, a muscle that goes from the low back all the way to the arm, and serratus anterior that goes from the side of the rib cage under the shoulder blade. By releasing this fascia, we improve upon the shoulder and arm range of motion and also reduce pain. I'm always thinking three-dimensional and using both my hands. Often one hand is an anchor, while the other hand or forearm is applying pressure to the fascia. Slumped and protracted shoulders and winging out of the shoulder blade is very common. This can cause limited shoulder mobility and often pain. In this video, I'm working around the inferior angle of the scapula with the fascia around the muscle latissimus dorsi. This is to bring the shoulder blade into a better position on the back closer to the spine. In the seated back work with the client starting in an upright position, he's then actively bringing the head forward and rounding the back, going into a forward bend with strong legs. This is a great way to lengthen the back extensor muscles, as well as taking tension out of trapezius, the rhomboids, and the large thoracolumbar fascia. Notice how the client stays active and gives me resistance and engaging his core throughout the whole hands-on application. In most of our SMT sessions, we include some of the seated back work as a finishing sequence. The fascia under the foot is part of the fascial backline, and when taut, can cause problems all the way up to the head and neck. I'm slowly gliding with my fist down the plantar portion of the foot while the client is extending by spreading the toes actively. This improves overall gait, reduces pain and tension. No SMT session is complete without working the fascia of the neck. Dry fascial work affects the sympathetic nervous system. It greatly influences the vagus nerve, which goes to all the internal organs, improves bodily functions such as digestion. The muscles and fascia we work in is upper trapezius, the neck extensor muscles, as well as affecting the nuchal ligament. And this ligament is attached to the spinal cord. It actually prevents the head from going forward. The scalene muscles are anterior neck muscles. They attach to the first and second rib. Often they get weak and tense. In this video, I'm carefully working towards the clavicle. This will improve breath capacity and also reduce tension in the upper ribs. The suboccipital area at the base of the skull, more often than not, has a great amount of tension, which can cause headaches and pressure throughout the entire cranium. Join us for a session and experience the benefits of synergetic myofascial therapy for yourself.